Meanwhile, the global death toll from COVID-19 has surpassed 5 million people. As the world continues to mourn those lost to the pandemic, there could be some good news coming for parents. The CDC is expected to authorize emergency use of the Pfizer vaccine for kids ages 5 to 11 sometime this week. Now, that means around 28 million children will be eligible for protection against the deadly virus. Dr. Mark Kline joins us now with more on this. He's a physician-in-chief at the Children's Hospital in New Orleans. Thank you so much for joining us. This is definitely good news for parents like me who have, been nervous about kind of venturing back out there. There are a lot of things open to adults who are vaccinated, but hey, I don't go anywhere without my kid hardly ever. So we're seeing a number of parents who got the COVID shot, though, still feel a little reluctant about their children getting vaccinated. With many worried about just how the vaccine may affect their children and their health, what kind of reaction do you anticipate children will have once they receive the shot? I know for some adults there was a sore arm. Some adults were, under the weather for a day or so and had to kind of call out. Do we anticipate that children may experience the same side effects?
We do, Anne-Marie. The side effects in children seem to be very similar to those in adults. I would classify them more as nuisance type side effects rather than anything serious. Soreness of the arm, as you mentioned, malaise, headache, low-grade fever that can persist for 24 hours. But given these very mild side effects that have been observed, definitely the benefits of vaccination far outweigh any potential downside.
There's a survey, Doctor, from the Kaiser Foundation that found a growing number of parents who are worried that the vaccines may negatively impact their child's future fertility. I don't want to be alarmist here, but is there a reason for these parents and their concern?
Vlad, no worry whatsoever on that. The CDC has looked at any fertility issues in adults and has found none whatsoever, no impact of the vaccine whatsoever on the fertility of young women, men, either one way or the other. We have no reason to believe that there will be any impact of the vaccine on fertility or the pubertal or sexual development of young children. These vaccines have proved remarkably safe in adults and in adolescents, and in the data that were used for the emergency use authorization of this vaccine in children 5 to 11 years of age. Again, a remarkable safety profile. These data for the 5 to 11-year-olds were obtained in about 4,700 children, so a sizable number. There were no cases of myocarditis, which has been another concern. Really a remarkable safety profile and again, incredibly effective in 5 to 11-year-olds, just as in older children and adults.
Vlad, I know why you made that comment about being alarmist, because often we're caught when it comes to this sort of misinformation, because we know that when we ask the question, we're bringing the topic up. But on the flip side, it's really, really important to get the accurate information out as quickly as possible before the misinformation can take root. Because sometimes just because people hear something over and over and over again, they think it's true. Repetition doesn't make it true. But let me ask you another question about parental concerns, Doctor. Say you have a kid who already got COVID. Should they still get vaccinated?
Yes. So the current recommendation is that even if you've had a case of COVID-19, you should be vaccinated. And that can happen as soon as the symptoms of COVID-19 subside and are gone. So there's no particular waiting period after having had COVID-19. The immunity that results from vaccination seems to be more durable, more complete than it is after natural infection. It's a little counterintuitive as to why that would be the case, but it does seem to be the case. And so, that's the recommendation. Even if you've had natural COVID, you should go ahead and get the vaccine subsequently.
So here's another question that parents ask, and they ask this of themselves too. In other words, they want to know if this is true for adults as well as children, but can kids who have received the shot stop wearing masks in school once they are fully vaccinated?
Yeah, it's a good question, and I'll give you sort of a qualified answer, Vlad. depends on the setting. So if the child is in a setting in which all of the children have been vaccinated and rates of COVID-19 are very, very low, it might be possible to forego masks. But so long as we're in an environment, which is the case in most places across the United States, where there is still a tremendous amount of community transmission of the virus going on, and still a sizable number of children, adolescents, and adults who are unvaccinated, probably the common sense and safer thing to do is to go ahead and continue to wear masks. It's unfortunate, but this would be true really of any respiratory virus of this type. Even when we have a protective vaccine like this one that is probably more than 90% effective at preventing infection and maybe even 100% effective at preventing hospitalizations and deaths, there are going to be some breakthroughs if the child is residing in an environment where there is a tremendous amount of transmission occurring among unvaccinated children and adults.
So, Doctor, I'm trying to think of all the questions that parents would have. And I know that I actually thought about this. We know that the Pfizer vaccine is 1/3 of what the adult dose would be. That totally makes sense to me. But then I also thought, there's a bit, if it has to, I don't know if it has to do with weight, size, and that's what what determines the volume of the dose. But I also thought there's a big difference between a 5-year-old and an 11-year-old, but they're still getting the same dose of the vaccine. Is that something parents should be concerned about?
Yeah, it's nothing that parents really need to be concerned about, Anne-Marie. This is something we've been dealing with in the field of pediatrics for as certainly as long as I've been a pediatrician, which is more than 30 years. We have to scale the dosing to the size of the child, but you can't scale to every particular size. You have to have certain cutoff points. And so invariably a parent will say, well, my 11-year-old is really big for his age, or my 14-year-old is really small for her age. And so should they get the adult dose or should they get the pediatric dose? And I think we just need to follow the guidelines that the FDA and the CDC put forward. These are they factor in all of the data they have from the studies, and they add an element of practicality. And this is just the way it's done in pediatrics. We're dealing with patients from that big to patients that are larger than I am, and everything in between. And so we're pretty accustomed to this, dealing with this question. I would say one other thing, one other question that has come up commonly from parents that I've heard is, were any corners cut? This seemed like it happened so fast. Were corners cut in studying this vaccine? And the answer is absolutely not. There was some urgency to getting approval of the vaccine for children 5 to 11 years of age. There are 28 million children in that age group, and so it was important that this be done expeditiously. But there were no corners cut. This vaccine has gone through exactly the same process that every other vaccine and every other drug approved in that age group has gone through and passed with flying colors.
Great point to reinforce, and hopefully you put some parents' minds at ease. Dr. Mark Kline, thank you so much.
Thanks for having me.